Hi, I'm Heather Newby, and today we're doing a webinar comparing traditional Medicare to Advantage plans. We're going to dive right in. I'm going to turn back on my screen and we'll get started. Okay, these are the topics we're going to cover today. So we're going to start with the big picture. We're going to look at a summary of what original Medicare is, what an Advantage plan is, and then we're going to do some cost comparisons, some coverage comparisons, and the pros and cons of both sides. Uh, just a side note, Jason and I don't prefer one side to the other. We like to make sure that you have all the information on making the best decision for yourself. So we want to make sure you're educated and understand what your options are and that you choose the side that works best for you. After we go through that, we are going to dive a little deeper into the different types of Advantage plans. Then we're going to talk briefly about indemnity plans and how those can support an Advantage plan and sometimes a supplement. And then we're going to wrap it up. So let's get started. This is what we like to call the big picture for your Medicare coverage. So you choose either the left side of the screen with original Medicare and what we call traditional Medicare, or you choose Part C, which is a Medicare Advantage plan. So you can't have both. You have to choose one path or the other. So we're going to start just by summarizing each piece briefly, and then we're going to dive into each piece a little bit more. So original Medicare, you have Part A, which is typically free. That's your hospital insurance coverage. Part B is what you pay monthly for. Part B this year is $185 a month. The rumor is that it's going to be $206.50 next year. So that's an increase. That hasn't been finalized yet, but that's what the rumor is. And then original Medicare itself only pays 80% of any hospital and doctor bills and has some large deductibles. So I'm going to skip ahead for just a moment. We're going to talk about that. So these benefits over here are a list of things that Part A and B do not cover. So that's why you get a supplement to come in and pick up the pieces that they do not. So the most popular plan, these are lettered, is a Plan G. Most of our clients have a Plan G, or some of them have an N. You can see if you have a Plan G, then everything is covered 100% that A and B do not cover, except for this Part B deductible. The Part B deductible is this year $257. We have heard that next year it will be $288. So if you have a Medicare Supplement Plan G, which is secondary to your Medicare coverage, then everything is paid for 100% for your medical and doctor needs after you've met your $288 Part B deductible. I'm going to back up here for another moment. So on traditional Medicare, you have original Medicare, which is through the government. Your supplement is secondary. So probably one of the biggest questions I have on traditional Medicare is how do I know my doctor or hospital will take my supplement? That is never a concern that you have to have because it is secondary to Medicare. They are federally regulated and they all have identical coverage and payment based on the plan type that you choose. So as long as your doctor or hospital takes original Medicare, which 98% of all doctors do, then they will also take your supplement. So in billing hospitals and billing doctors' offices, they get confused on that sometimes. So if you were to call them and say, well, do you take XYZ supplement? They may say, no, I've never heard of them. Or they might say, yes, we take some of their plans because sometimes those companies also have Advantage plans where you do have to be concerned about networks. So just know that if you have original Medicare, then as long as they take Medicare, doesn't matter what the name of your company is for your supplement, they will also be accepted as well. So traditional Medicare, it has very a la carte coverage. So you can see we have your medical coverage are these two pieces together. That's your A and B, and then your supplement. And then to get your prescription coverage, that is a separate plan itself as well. Um, I'm not going to dive into prescription coverage much in this presentation today because the way that prescriptions are covered on traditional Medicare and Advantage plans are very similar to each other. So they both have tiered prescriptions, copays based on what tier they're on, and deductibles. So typically, when we're comparing whether you should go traditional Medicare or Advantage plan, the costs for your prescriptions either way are very similar. There are some cases where that's not the case, but typically that is what we see. So I'm not going to really talk much about that. But again, so traditional Medicare, freedom to see any doctor. You pay a monthly premium for original Medicare and your supplement and potentially your drug plan. And then you have a very low deductible for the year. So no surprises on medical costs. You know that you have that low deductible, and that's the most that you're going to spend medically. So now we're going to flip over to Advantage plans. So Part C is an Advantage plan. If you have an Advantage plan, you are actually not on Medicare anymore. So a private insurance company is now in charge of your coverage. You do still have to pay for Part B with Medicare, even though you don't have Medicare, because Medicare uses your premiums to subsidize these Part C plans. So even though you're not technically on Medicare, you're still paying for Part B. These plans are network based. So a lot of, depending upon the plan, you may have to stay within a network of doctors to have coverage. Some plans allow you to go to out of network doctors as well. And I'm going to touch on that a little bit later. But you do have to be a little more conscious of making sure that your doctors and hospitals are in network versus traditional Medicare. Most Part C plans have a zero premium. So this is a huge advantage to the Advantage plans is that there is no premium for the plan. So you're just paying for Part B. There are a few plans that do have a small premium, but typically they do not. So how do you pay your Part C? So as you use services, you pay copays for the services that you're using. And then if you reach what we call a MOOP, M-O-O-P, a maximum out of pocket, then you have no more copays for the year. So your copays add up. And if they reach that ceiling of the MOOP, then you have no more copays for the year. And this is for a calendar year. So it resets every January. The Advantage plans include a lot of bells and whistles like dental, vision, hearing, over-the-counter stipends, silver sneakers, gym memberships. And this is what you see on TV a lot that they advertise for. So they're always trying to entice you with these extra items, and they are some great benefits that are included with these plans. So let's look a little bit at what those copays look like. This is just an example. So as you can see here, in this particular example, if you were to go visit your primary care physician, it would be a zero copay. There's also a large list of preventative screenings like cardiovascular screenings, prostate exams, mammograms that are also included each year free of charge. But if you need to see a specialist, it might be a $30 copay. If you need to go to the hospital, it might be a $300 copay per day for days 1 through 6. If you need some diagnostic testing, that can range usually depending upon the test and where you're having it done, $50 to $200. Now, again, these are just examples. They can be very different depending upon the plan that you have. Part B prescriptions are prescriptions that are administered in the doctor's office or in the hospital. So these would be like infusions or injections, and you pay 20% of the cost on that. And then again, prescriptions, regular prescriptions that you pick up at the pharmacy are structured very similar to the Part D plans on traditional Medicare. Okay, so let's review what our costs would be. On original Medicare, Part A is free, typically, unless you haven't worked 40 quarters or your spouse hasn't. Part B, we think, is going to be $206.50 next year per month. A Medicare Supplement Plan G typically ranges in price from $120 a month up to $250 a month. This depends on your age, your location, even if your sex. So women are typically slightly cheaper than men when it comes to supplements. Um, so that's something that has a range, but we can discuss how the pricing works for that one-on-one. Prescription drug plans can be anywhere from $0 up to a very expensive $100 plan. The more expensive plans are tailored more to specialty drugs, and typically people are falling closer to that $0 cost, or maybe $10, $20 a month, if you're just taking some regular name brands or some very common generics. So traditional Medicare, you're spending about $325 to $500 per month in premiums. And for that, you only have a $288 medical deductible for the year. On the Advantage plan, you still pay Part B. So the $206.50 monthly is a wash between the two sides. But the plan itself is typically a zero premium. So big savings there. Your potential costs on an Advantage plan, though, of course, is your max amount of pocket. So if you have a year where you hardly ever go to the doctor, obviously you're going to save money monthly because you're not paying for that additional supplement and potential prescription plan premium. If you have a very expensive year medically, then it's possible that your copays could add up to more than what you would have spent if you had paid for a supplement and prescription drug plan. So again, your total on an Advantage plan is going to be just your Part B premium, most likely, and then potentially your copays. We saw average max amount of pocket this year in 2025 was around $4,000. Some states are slightly less. Some plans have higher max amount of pockets depending upon what type of plan it is. We're going to talk a little bit about that later, but that's a good range or thing to think about. On a side note, though, I will say that the nice thing about the Advantage plan copays is that they are small and manageable. So you're not paying 100% of this huge doctor bill until you reach that max amount of pocket. They are, like I said, small and manageable. So I've had clients that have had complete knee replacements with the specialist coverage and the testing and the rehab and still not reach that max amount of pocket. Same as, people that have had open heart surgery, still not reaching that max amount of pocket. So I don't want you to think that just if, oh, I have one major health issue for the year, that's going to hit that maximum immediately. So that's just not the case. So comparing your options between the two. The pros of traditional Medicare is the freedom to see any doctor that you want and having more freedom of choice of how your care is handled. And I'm going to talk a little bit more about that in just a second too. So definitely if medical freedom and knowing that you're going to have know what your cost is each month because you have the premiums that you can count on. And then knowing that you have a very small deductible for the year sometimes is comforting to people, and people like that about the traditional Medicare option. No surprise bills. The cons for the traditional Medicare is that there is a larger monthly out-of-pocket cost. So it costs more for you, and it is a la carte coverage. So there's no extra dental, vision, silver sneakers, hearing. If you want those coverages, we have options to get other policies for those. But again, that's an additional monthly cost that you're paying for. Advantage plans, the pros are the low monthly premium. So, you're just paying the Part B, typically not paying anything else on top of that for premium. So you're saving monthly in your budget. The bells and whistles are great. People love the fact that they have free dental coverage included or some vision coverage. They can go to the gym with silver sneakers. Those are all great benefits that are included in the Advantage plan. The downside of the Advantage plans is possibly having to stay within a network of doctors. Now, in the Indianapolis area, the network is huge. If you're in a greater city area, typically the networks are very large and that's not an issue. But, you do have to be conscious of making sure that your doctors are in network. There have been some cases where there has been some medical constraints put on people for how they want their care. And I'm going to give you an example of that. If someone needed to have shoulder surgery, so a doctor recommended shoulder surgery, and they submitted it for approval from the Advantage plan can come back and say, we will approve it after you've done 6 months of rehab first to see if that solves the problem. So it doesn't come up very often, but we have seen it happen a few times, particularly if you're doing something like injections for your back. We've seen some pushback on that. So that's just something to be aware of. It doesn't come up, like I said, very often, but it can. Another disadvantage to the Advantage plan is, you do have the copay. So if you have a very expensive year, then you could end up paying more for the Advantage plan than traditional. Okay, let's talk about switching plans. So if you currently have a Medicare supplement and you want to switch to a different supplement because it's cheaper, then we can do that any time of the year. We don't have to do that just during annual enrollment period. There is underwriting involved. So you do have to pass medical underwriting. And there's a new law going into effect in the state of Indiana next year where there's some workarounds for that too. So we're going to talk more about that in the supplement webinar that Jason's doing tomorrow. And I can talk one-on-one with that about that a little bit too. But typically going from supplement to supplement, you're going through medical underwriting to get into that company anytime. If you're going from traditional Medicare, which is the supplement, to an Advantage plan, you can only do that during annual enrollment period. So again, that period is what we're getting ready to go into, October 15th through December 7th, and there's no underwriting involved. If you're going already on an Advantage plan and you're going to a different Advantage plan, you actually have two opportunities to do that. You can do that during annual enrollment period or during open enrollment period. Open enrollment period goes from January 1st through March 31st, and you can make a one-time plan change for Advantage plan members during that time. So if you stayed on your plan from last year during annual enrollment period, or you switched plans and then the beginning of the year rolls around and you're saying, oh, I don't really like how this plan is working, you do have the opportunity to make a one-time change during the first quarter. If you're going from Advantage plan to supplements, you can only do that during annual enrollment period. And you would have to go through the underwriting for the supplement. The supplement, again, we can start anytime. The reason why we can only do this during annual enrollment period is because the prescription portion of it can only be added during annual enrollment period. So we would go through the underwriting of the supplement. If you're accepted and then the supplement is good to go, then we would make sure we get the prescription drug plan ready to go as well with a January 1st start date. This special circumstance is very important to pay attention to. If you are considering an Advantage plan for the very first time and you've never been on an Advantage plan before, you have a 12-month free look period. At any time during that first 12 months you're on an Advantage plan, you can go back to your supplement and prescription plan with no questions asked. So there's no underwriting. You can do it 3 months in, 9 months in, 6 months in. Anytime you feel like this is not for me, you have the option of going back. So for people that have been nervous to take that giant step to go from traditional Medicare to an Advantage plan, this gives you a little bit of peace of mind that you have a chance to give it a try, and there's no harm, no foul. You can go back to what you had as long as you do so in the first 12 months that you're on the Advantage plan. All right. We're going to kind of switch gears here and we're going to just kind of focus in on Advantage plans. So when I'm talking to people about choosing an Advantage plan, these are the questions that I ask. What are you looking for from your plan? So, is it most important to you that you have the largest doctor or hospital network available? Are you looking for the lowest out-of-pocket monthly costs, premium costs? Do you travel a lot? So on any Advantage plan, emergency care is always considered a network. So if you're traveling somewhere and need emergency care, you can get that. But there are some other plans out there too that offer some out-of-network advantages if you are traveling. So say you're, visiting someone for a couple of weeks and you get a cold and you want to go to urgent care, some plans provide coverage for that as well. Are you looking for the lowest max out of pocket or copays? So, if that's your biggest concern, some people just say, I never go to the doctor, but I go to the dentist a lot. So I need to make sure I get the best dental coverage. These are important things to think about and communicate with us because there's lots of plans out there, but there isn't one plan that's like, oh, this is the best one. It really depends on, if what portion you're looking for, and then we can say, oh, well, this plan has the most dental, or this plan offers the travel opportunities. So those are important things to convey with us. That being said, I don't get 2026 plan information until October 1st. So I can't speak specifically to next year's plans yet. That's why I'm doing that short webinar on October 2nd. And in that particular webinar, there's a prescription plan webinar and an Advantage plan webinar. I'm going to talk about specific plans for 2026. So these are different types of Advantage plans that you can have. The most popular plan is an HMO. HMOs basically are set up where you have a network of doctors and hospitals, and you have to stay within the network, of course, unless it's an emergency, always considered in network. If you go out of network, though, and it's non-emergency, you have no coverage. The reason these are the most popular, though, is because they typically do have the lowest max amount of pockets. They typically have the lowest copays, and they typically have the most bells and whistles included. So people find that the networks are large and they have no problem staying in network. So the HMO works well for them. PPO gives you an in-network and out-of-network option. But typically you have a higher max amount of pocket. And a lot of times some of those extra benefits are cut back a little bit. I have a lot of clients that start with a PPO and end up switching to an HMO down the road. And here's why. PPOs sound great because you think, oh, I have more options. I can go out of network. But if you go out of network, first you have to make sure that the doctor or hospital will accept your plan. And if they do, you'll see that the copays and the max amount of pocket for out of network are much higher than the in-network doctors. This isn't always the case, but this is typically what we see. So a lot of times people will start with the PPO because they're a little nervous about being constricted by a network, and then come back to me and say, I'm ready to go to the HMO because I'm never going to go out of my network because the price is so much higher and it just doesn't make sense. So that's my 2 cents on that. The next type of plan we're going to talk about is called a give back. These came about just a couple of years ago, and they are really structured for people that want the least amount of monthly premium coming out of their pocket. What they do is they are a zero premium plan, but then they also reimburse you a certain dollar amount each month for your Part B premium. So, Part B is $185 this year. If you have a $100 give back plan, they would give $100 of your $185 back to you each month. So you're only paying $85 now for your monthly premium. What you give up to have that is you'll have higher max amount of pockets and copays. You'll have much lower extra benefits. So this is a plan that is really tailored to people trying to keep that their monthly premium at the bare minimum. Now, we do have some strategies where we can use some other products, indemnity plans and dental plans and that kind of stuff to add some of that coverage back in. And sometimes it still ends up being cheaper than what you were getting back from them. So that's something that we can talk to you about if you're interested in it on a one-on-one basis. The last type of Advantage plan we're going to touch on is specialty Advantage plans. There's a few out there. The most popular ones are VA. So if you are a veteran and you use the VA, there are some wonderful Advantage plans for you. So I would love to talk to you one-on-one about what those options are. The other type of specialty plan is called a DSNP. This is for people that have Medicaid and Medicare. So Medicaid, you have to financially qualify for. You have Medicaid and Medicare. These plans are great and they have some wonderful benefits. And that's also a one-on-one conversation that we would have about that. All right. Number one biggest concern for people going on Advantage plans are typically the max out of pocket and the copays. So there's a couple of things I just want to touch on that are options of ways to ease that potential pain. The first being a hospital indemnity plan. So if you have a hospital indemnity plan, then your plan basically reimburses you if you have a copay event. So let me give you an example. If you go to the hospital and you spend a day there, your copay through your Advantage plan might be $300 a day. And if your hospital indemnity plan will reimburse you whatever amount you chose for that hospital indemnity benefit. So potentially you could have set it up so that $300 comes back to you if you go to the hospital. So how that would work is your Advantage plan would charge you $300 and then your indemnity plan would pay you that $300 back. And these can be tailored to have different coverages, different size coverages, different, obviously, the more coverage that you have, the more you pay for it monthly. But these are, even if you get something small there that can help with some of these copays, these can really be beneficial to people. And especially if you're doing a give back plan, these are great because if say you're getting back $100 on your give back plan, if we did a $50 per month hospital indemnity plan, you may end up getting back most of your copays and max amount of pocket costs and still saving an additional $50. So this is just a strategy that we can use. The other type of plan is called a cancer or heart attack stroke plan. And we love this plan because cancer is the number one expensive medical issue for people. So, between the diagnostic and the doctor visits and the treatments and the medications, you would experience a lot of copays if you were diagnosed with cancer. What we love about these plans is it's very simple. If you get diagnosed with cancer, they mail you a check. So depending upon the size of the plan you want, you can get a $2,000 plan, $5,000 plan, $10,000 plan. They will mail you a check for that amount if you are diagnosed. Same with heart attack, stroke. So what we really like about this is if you don't get cancer, which of course we all hope we don't, then when you turn 75, after you turn 75 and your policy renews, they mail you back all of your premiums that you paid for the whole year. So it's kind of like a glorified savings account. If you don't use it, you're going to get a check when you turn 75 or after you turn 75. And if unfortunately you do need it, you get this lump sum amount of money that will help alleviate some of the pain of those copays and things that you're experiencing. These are great for supplement clients too, because prescriptions can be very expensive if you get diagnosed with cancer as well. All right. That is all I have for you guys. Just wanted to remind you tomorrow's webinar is with Jason. He's doing supplements. That will be at 10:30, and he's going to dive into some changes in supplements that are going on and talk about specific plans and things that are coming up. The two other webinars will be put on by me, the prescription plan and Advantage plan. Those are both on October 2nd. Since I get plan information on October 1st, I'm going to be reviewing it quickly and then hosting those two webinars that are going to be very plan specific about what I'm seeing. Then October 3rd is the day that we will mail you the email with instructions on how to submit your review information to us. We have to collect information that way. It ensures that we get your correct prescription and doctor list if you're on an Advantage plan, and then also the government forms that we're required to have on file. So Look forward to meeting with all of you this year and talking by email or talking over the phone. And I hope you're all doing well, and we will see you soon. Thank you. Bye bye.